Minister of Justice says police will be intensifying their controls of motorcycles and scooters. Member of Parliament Claudius Moncamper says we are not being treated fairly by the Dutch. But first up, Prime Minister gives an update on COVID-19 cases. Those are the headlines for Wednesday, April the 8th, 2020. This is SXM Daily News. I'm Valerie Van Putten. Now for the details. Prime Minister Sylvia Jacobs has given yet another update on the current COVID-19 situation in her latest national address of Wednesday, April the 8th, 2020. She spoke of the 3 new cases and says that the numbers are going up.
Minister Vesa already did quite some of the updates that I would have given, but I did receive late last night that we have 3 more positive cases. That's the only change I would add as of now to what I announced yesterday evening. So we are now at 43 positive cases. We continue to move around within the community. So not only waiting on persons to call 914, but based on the contact tracing that is taking place, you may see the quarantine numbers or the isolation numbers go up. I have seen or noted that with the updates that I received yesterday from CPS, that the self-quarantine numbers went down drastically, and that is due to the fact that most persons have come out of their 14 or 21-day quarantine, depending on what reason they were quarantined. I'm reading and hearing more and more that some people have started showing symptoms after traveling up to 15 and 16 and 17 days after. So I will be bringing forth in the EOC meeting this afternoon the possibility to extend quarantine to 21 days to ensure that persons are not going about in the community still carrying the virus. As you know, if you follow the worldwide news, persons can be carrying the virus and be asymptomatic. And that is why it is important that we remain on this lockdown for the 2 weeks to ensure that we can contain the spread. We've already been locked down from the outer world, so the most persons who have traveled are already within 2 to 3 weeks back on the island. And I would like to ask those to continue to monitor themselves for late development of symptoms. Every and any person who develops symptoms that are flu-like, if you think for any cause, any reason, because when I look at some of the videos whereby you may have just passed a paper to someone, whereby you may have just had a conversation with someone within 6 feet or within 1.5 to 3 meters, that it is possible that you could have exchanged fluids in the air, let's say. So we cannot be too precautious. Now that we're in this lockdown phase, if you have to interact with persons outside of your home, it would be the best for both parties to wear at least a surgical mask.
And at the Council of Ministers' weekly remote press briefing, the Prime Minister said that there is a lot going on. She made a correction as to what should be worn and how it should be worn as it pertains to wearing masks. The Prime Minister said that the health professionals on the island says that cloth masks are not effective at all. It must have some sort of protective barrier.
A lot going on, and I have to correct some of the things I said yesterday. The health professionals got on my case that cloth masks are not effective at all, just plain cloth. So it must have some type of a protective barrier. The surgical mask, if both people who are in the room are wearing them, then they are keeping their own germs or viruses to themselves and therefore not spreading it on the computer, on the phone, etc., etc., etc. This does not mean that you should not wash your hands as often as possible. I would also like to echo the sentiments of condolences, the heartfelt sympathy to all those who may have lost loved ones, friends, colleagues over the past few weeks, especially to COVID-19. As I mentioned last night, 2 of our numbers that we added were cases that did not necessarily have COVID-like symptoms, or not many, or maybe just for 1 day or 2. So it is mainly for these last 2 cases that they had underlying other medical conditions that more contributed to their demise than COVID-19. Persons who are diabetic, persons who have high blood pressure, heart conditions, lung conditions, or are obese are more prone to develop severe conditions. That is why we have asked that you stay away from the elderly, not just those in the St. Martin home or the White and Yellow Cross facilities, but also those who live alone or within your family structures. We know that several generations live together, and I would like to ask that you protect the elderly in your family, especially if you are still moving around as essential service or to do whatever it is of an urgent nature that you need to do outside the home. So make sure you protect your family by washing your hands when you enter your home, in fact, changing your clothing and having a shower before interacting with the elderly. In doing our contact tracing, it is sometimes difficult to even figure out with the last 2 cases up to now, not the last 2 cases, the last 2 numbers that have been added, how they even contracted the virus socially. So because of this social or community spread, as it is called internationally, we are admonishing all persons to remain at home. Please, the police on both sides of the island and the gendarmes are working diligently. Some people feel they're asking too much questions, but without that, we are having persons moving for no urgent reasons. Only persons who need to move for urgent reasons or are part of the essential services need to be on the road, and only to do that particular business and go home.
And in news out of Willemstad, Curaçao, epidemiologist Dr. Izzy Gerstenbluth confirmed today during the daily briefing that Curaçao now has 14 cases of the COVID-19 virus. According to Dr. Gerstenbluth, 223 have been tested up to now, 14 were positive, 7 are safe, 1 has died, 1 is still in the hospital, and 5 are isolated. From those who returned to the island after the measures were announced, 120 are still in quarantine and are being monitored by the health department. The doctor also indicated that 2 days before you get symptoms, you are still contagious, research has shown. Therefore, everyone should stay at home as much as possible. And now back on St. Martin. In this sad item, the police on St. Martin found a man deceased in the soccer garden area on Wednesday, April the 8th, 2020. There were no signs of violence on the individual. Doctor was on location and pronounced him dead. He most likely died of natural causes. SXM News will keep abreast of this story and will release more information as we receive it from the police department. Our condolences to his family and friends. And as we continue with more news at this time, due to the interruption in classes relating to the coronavirus situation, Minister of Education, Dr. Anders Rodolph Samuel, said he has sent a letter to the school boards explaining that the exams have been canceled. The minister also explained that they are waiting on an update to see what will happen with the CXC exams as well. He also gave an update of the various education programs for the remainder of this year.
As Minister of Education, I have sent out a letter to the school boards informing them that indeed, because of the interruption of school in the normal way, that some exams have been canceled. We are talking about the foundation-based exams, of which the FBE exams have been canceled, and the traffic exams for Group 7 have been canceled. We also have from the secondary education that the central written exams for the VSBO, so that is the TKL, PBL, PKL, HAVO, and VBO, have been canceled. The Cambridge exams, the Cambridge Dutch exams, They also have been canceled, and we know that the CXC exams, we are waiting on an update on what will finally happen in that area. The IB diploma programs, the program scheduled between the 30th of April and May 22nd, this will no longer be held. We have two other institutions that are very interesting to keep an eye on, and that is the NIPA and the University of St. Martin. The University of St. Martin at this moment is continuing with classes, and we are following the developments as we continue. And the NIPA, because of the lockdown, is experiencing at this moment some interruption. So we would check based on the lockdown what the final decision would be for the educational program of this year. Some students, as we have been checking on, we have noticed that they are not connected digitally. So the Department of Education, which is busy checking on which students can get lessons from their teachers digitally, have noted indeed that some of them are not connected in the way that it should be. So for these, we are looking for a solution to see how we can make the connection for these children so that they can have their education in whichever way possible continue.
And still to come, TLM Group taking its corporate citizenship seriously. You'll have the details of that story and more when SXM Daily News returns.
GEBE has been faithfully serving the communities of St. Martin, powering your home and our economy. Come rain or shine, our qualified team of professionals are working hard 24 hours a day to provide you and your family with safe, reliable electricity and water. We use the latest technologies and test our products daily to maintain the highest international standards. Our friendly staff is always there to assist you, whether in person, over the phone, or online. We are committed to constantly improving our products and services, making them more efficient, effective, and environmentally friendly to serve you better today and our next generation of clients tomorrow. GEBE, powering a brighter future.
Our friend Megawati is here with tips to save you energy. 1. Turn your airco temperature up. 2. Use a ceiling fan instead. 3. Buy energy-saving products. Save some green with NVGEBE.
And as we continue now with more news, TLM Group assistance to the St. Martin government and people affected by the current coronavirus emergency has been outlined to telecommunication counterparts in the Caribbean region. The information has been requested by the Caribbean Association of National Telecommunications Organizations, CANTO, based in Trinidad and Tobago. They are interested in finding out what member organizations are doing in their respective communities. According to TLM Group Chief Commercial Officer, CCO, Mr. Michel Parent, TLM Group has been cooperating with government from the outset of the crisis, offering the company's telecommunication networks to communicate important messages to the general population related to the coronavirus.
We at TLM, we see it as our corporate social responsibility not only to assist government in any way possible to provide the people of St. Martin with as much corona-related info as possible. We are also putting things in place to try to lift the burden for our customers. For government, we created the number 914 for corona-related questions. That's a free of charge number. But we also recently opened number 311, which is also a free number for the Mental Health Foundation. We have launched an SMS number called Corona Info for governments to send messages to our customers. And in addition, 15,000 flyers have been created in 4 different languages, English, Spanish, French, and Creole, to provide COVID-19 info. For our customers, we still have the double data promotion, so you get double the amount of data for the same amount of money. And also, customers now can top up online via www.telceltopup.com. In addition, we have decided also to be very lenient to our residential broadband customers, and we are not disconnecting any of them. However, TLM still urges our customers to go online and pay their bills. If you need any instructions on how to pay your bills online, we advise you to follow us on Facebook at Telcel NV. We understand that this is a very volatile situation and it changes from one day to another. So we are currently also in contact with the supermarkets who offer their services and provide groceries to your house. We are in contact with them, so you could also you can also purchase Telcel credit by them and get it delivered to your house. We understand it's a very volatile situation, so we are looking at this on a day-to-day basis, and after the curfew, we are reevaluating everything, and we are, in the meantime, trying to keep our services up and running and trying to keep our customers as happy as possible.
And as we continue with more news at this time, Member of Parliament Claudius Moncamper says that we are not being treated fairly. We should have equality and respect for each other, and when we have issues, our Kingdom colleagues are more than willing to go out and help their European partners than help us, their Kingdom partners. We are being treated like stepchildren. Is it because we were bold enough to ask for more autonomy?
We're talking about equality, respect for each other, and when we have an issue like this, you are more than willing to go out with €1 billion free of charge to help your European partners instead of your Kingdom partners. France and Spain are not in the Kingdom of the Netherlands, but St. Martin, Aruba, and Curacao are. Yet we are treated as stepchildren. Is it because we were bold to ask for more autonomy? Is it because maybe we were bold to ask for independence? Most of the people in St. Martin in the referendums did not vote for independence. They voted to remain within the Kingdom, not only for the passport, but for the financial security that the Kingdom gives its partners. Holland is the 7th or 8th richest country in the world. These people have money. And I know it's their money, and we shouldn't just be demanding what we want or when we want it. But this is not the making of a corrupt government or a bad government. COVID-19 is taking out people all over the world. The Netherlands has, 15,000 infected people, 1,200 in the ICU. Over 1,200 persons have deceased. I mean, for God's sakes, this is a serious pandemic. But if you look at the overall numbers, because you have to look at them population-wise, Holland has 17 million people. We have 50,000 people. If I take Dutch and French together, our death ratio towards the population is higher than that of the Netherlands. So you have to understand where we are going. And I'm stating this because I need everybody to get on board. And not only the Minister of Finance and the Prime Minister and trying to fight the Dutch government in explaining to them that people, you cannot treat us so. I think the SHTA, the IMA, all of them should start writing letters to Mr. Knops and asking, why are you treating us as second-class citizens within your kingdom? If we truly want to make a difference, this is the time to make it.
Now turning to our weather forecast for April the 8th, 2020. Lingering moisture associated with a weak shear line will result in cloudy periods and possible isolated showers across the region. A weak Atlantic high-pressure system will maintain gentle to moderate winds. Seas will remain slight to moderate during the next few days. Now let's turn to your 3-day forecast. And still to come, Minister of Health is stressing on the importance of the community adhering to the rules. We'll have the details of that story and more when SXM Daily News returns.
Make use of WIB mobile banking with easy access and direct usage of face recognition, PIN code, or fingerprint. Download WIB mobile banking app and make your transaction from anywhere at any time. For more information, visit wib-bank.net/quick-login.
And as we continue with more news at this time, Minister of Justice Anna Richardson extended her condolences to the families of the latest local COVID-19 victims, as well as others that have passed. The minister also announced that the police will be intensifying their controls of motorcycles and scooters.
In regards to those that have passed on due to COVID-19, I am extending my condolences to their family and loved ones. We also had some persons that passed on non-COVID related. I'm also extending my condolences from my staff and my person. I am happy to report and know that the young boy who was missing yesterday has been found, and I'm happy to know that he is now back with his family. I know that we are in some trying times. There is some boredom that is being experienced by both adults and children, but I'm asking parents as well to try to do some more activities with your kids at home, that you have an eye on them, and that we can all go through this experience that is new to us safely. I'd like to bring some information and updates to the public with regards to efforts within the Ministry of Justice. Today, you will probably see an article released from the Ministry of Justice, my person in particular as minister, calling for patrol to execute controls on motorcycles and scooters. We have received quite a number of complaints from residents, especially within our COVID-19 curfew space, where a lot of motorcycle and scooter riders are still utilizing the public streets. They are, riding up and down. It's quite noisy, so there's a nuisance there. Riding through, essential staff that are on the road are also experiencing that, and this must discontinue immediately. Individuals besides that are utilizing or using motorcycles and scooters on the public roads must have required documents such as a license to operate such a machinery. You should have insurance, your road tax should be paid, you should be wearing a helmet, you should be able to even show proof of ownership. As such, if the authorities find anyone on the public roads where you should not be, first of all, within the curfew, and you cannot produce the documents I've just outlined, the motorcycle or scooter will be taken from you. Yes, it will be kept in a secured facility, and should you be able to provide the documentations to support your ownership, etc., it will be released to you, but with a fine attached.
And in health news, Minister of Health Richard Pandafleck at the weekly Council of Ministers press briefing congratulated the health workers on World Health Day. The minister also stressed on the importance of the community adhering to the rules where it pertains to restrictions during this state of emergency.
Yesterday, April 7, was the World Health Day, a day to celebrate and honor the work of nurses, midwives, and those in the medical field. As they play a critical role in keeping the world healthy, I salute all of them who are in forefront of the COVID-19 response. COVID-19 is not only affecting the lives of the people of St. Martin, but the lives of the whole world. As Minister of ASR, I would like to stress on the importance of adhering to the rules and restrictions set forth by the Prime Minister, the chairperson of EOC, during the state of emergency. As your Minister of Health, Social Development and Labor, it is important that social aspect of the ministry is not overlooked. In the last weeks, ESF7 had several meetings with church leaders and community councils with the main objective to partner with them. These meetings will continue in the near future. I would like to express my appreciation to the VSR staff and volunteers and all who are helping, preparing with supplying of food baskets to the financially vulnerable and those negatively impacted by the COVID-19. Approximately 762 boxes of food and 697 hygiene boxes have been packed. The packing of the food boxes began on Saturday, April 4th, and still ongoing, and the distribution began Monday, April 6, 2020. The government of St. Martin will continue to work relentlessly to ensure that every qualified person is assisted. These are trying times, but such situations are what pulls the community together.
And still to come, St. Martin Medical Center preparing for more suspected or confirmed COVID-19 cases. I'll have the details to that when SXM Daily News returns. And as we end this edition of SXM Daily News for this evening, St. Martin Medical Center, SMMC, is preparing for more suspected or confirmed COVID-19 patients that need to be admitted to the hospital. Based on a case study and data analysis from other COVID-19 countries where communal spread has occurred, estimates on the actual number, not to be confused with the reported number of infected persons in the community, can be forecasted based on the mortality rate and the doubling in cases over a specific number of days. COVID surge and pre-existing conditions as per April the 7th, 2020. St. Martin Medical Center has admitted 12 COVID-19 related patients since the start of the outbreak, of which 2 are currently admitted and in critical condition and being ventilated. 5, unfortunately, have died, and 5 have been discharged and are in stable condition in strict home isolation. From the admitted COVID-19 related patients to St. Martin Medical Center so far, the conclusion is that patients are predominantly in very poor condition. The conclusion is that patients are predominantly in very poor condition and in most cases suffer from comorbidities, which is pre-existing health conditions such as hypertension, diabetes, asthma, and or overweight. Looking at the patient population on St. Martin where hypertension, diabetes, and overweight are common health issues, St. Martin Medical Center expects a surge in the number of suspected COVID-19 patients that are in extremely poor condition once admitted to the St. Martin Medical Center. And with that, we've come to the end of this edition of SXM Daily News. Thank you for watching. I'm Valerie Van Putten, and just a reminder that this and other programs are available online. Simply log on to stmartinmediacenter.com for viewing. And on behalf of the SXM Daily News team, we thank you for watching and plan on meeting you right back here again tomorrow.